Our presenter today is Valerie Bohlen. Val is the services coordinator for Mary Greeley Home Health and Hospice and has worked at Mary Greeley for almost 7 years. Val graduated from Iowa Wesleyan College in 1977 with her Bachelor's of Science degree in nursing and has worked in the nursing profession for almost 44 years as a staff nurse and in several leadership positions. 11 years ago, she and her husband moved to Ames from Southeast Iowa to be closer to their children and grandchildren, so her nursing profession had to move with her. After working in the Des Moines area for 3 years, she accepted a position with Mary Greeley Hospice and has enjoyed every minute of her service there. Throughout her adult years, she has participated in several community and hospital services that include Stevens Ministry, facilitating classes like Grief Share, Growing Kids God's Way, The Customer, Precept Bible Studies, volunteer trainings, and mentoring others. She loves people and wants to serve them in any way she can, even if it is in their last days of their life here on this earth. So please welcome Val Bohlen.
Well, thank you, Vicki. It's a pleasure to be here, but I'm used to seeing people in front of me, so this is going to be very unusual because I like audience participation, and I won't get that until the very end with questions. So, yeah, just bear with me. If I asked you to do something, just pretend like you're sitting in front of me. If I ask you to raise your hand, raise your hand. If I ask you yes or no questions, answer them wherever you are. But it's great to be here. Yeah, like Vicki said, I've been a nurse for almost 44 years. I've been in different positions. I've been on nursing floors, medical, surgical floors. I've worked in the operating room. I've worked with 5 surgeons in Southeast Iowa, scrubbing in with them on their surgeries, doing their hospital bookwork. I was director of admissions at a hospital in Southeast Iowa. Actually, I'm from Burlington, so it was at Great River, if anybody's been down that way. And while I was at Great River, I worked in home care and hospice, and then that's when we moved to Ames, and that's what I've been doing ever since. So I've been a caregiver for a long time. I'm past the age of 65, so I've had many years' experience, and I'm sure all of you who are listening have had that same experience. So what I want to do is ask some questions here. Okay, this is where you have to raise your hand. I can't see it, but I want you to raise your hand. How many of you are caregivers right now? Raise your hand. Okay. How many of you have been caregivers in the past? Raise your hand. How many of you will possibly be caregivers in the future? Raise your hand. How many of you are in a profession of caregiving? Raise your hand. And how many of you are or possibly will be long-distance caregivers? Raise your hand. All right. Well, before we get into taking care of caregivers, I want to go over some definitions. These are definitions that you probably already know about, but they're important to know because when we are in that caregiving role, these different types of things pop up. We don't like it when they pop up, and so we're going to try to deal with it right now. So stress. What is stress? Stress is an effect that our bodies can experience as we struggle to cope with our continually changing environment. How many of you are stressed right now? I am, because I'm doing this presentation. Number 2, Stress. It is experienced when a person perceives that demands exceed the personal and social resources that the individual is able to mobilize. And then the third thing, it can have physical and emotional effects on people that can be both positive and or negative. Some positive feelings could be exhilaration, creativity, just being busy and successful and having productive work done. Now, negative feelings could be being overwhelmed. You could have some distrust, rejection, anger, depression. That doesn't sound good, does it? Doesn't sound good at all. Well, what are some signs of stress? Signs of stress. I wish you were here that you could just yell it out to me. But you're not, so I'm going to read some signs of stress. Loss of appetite or craving for certain foods. Infrequent indigestion, heartburn, stomach upsets. Sleeplessness, constant tiredness, fainting or dizziness, headaches, backaches, muscle spasms, frequent tears or the urge to cry, frequently feeling irritated, difficulty in relaxing, obsession with fear of disease, the feeling of hatred or neglect, unable to make decisions, lack of interest in other people, suffer from guilt and or sense of failure, afraid to open or in confined spaces, or just being alone. There's a lot of signs of stress. How many of you are in stress right now? Well, I'll tell you, this is very interesting because one of those is unable to make decisions. My husband and I, we are driving down Duff Avenue and we're trying to find a place to eat, and neither one of us can make a decision. Do you know how stressful that gets? That gets really stressful. But look at all these other stress, signs of stress. Lots of them. The next definition we're going to talk about is frustration. Frustration is a normal and valid emotional response to many of the difficulties of being a caregiver. It can have serious consequences for you or the person you're caring for. It's important to distinguish between what is and what is not within your power to change. It arises out of trying to change an uncontrollable circumstance, especially if you're caring for somebody that has dementia, somebody that has Alzheimer's, somebody who has a terminal disease that is progressing towards the end. Frustration is you are able to control one thing, and that's how you respond to that circumstance. So, signs of frustration. How many of you are frustrated right now? I see this dog right here. He's going crazy. He's frustrated. Now, I have a black and white dog. He is a real cute little thing. And last night, we were outside taking a walk. He saw 7 rabbits. He saw the rabbit. He started stalking the rabbit. And then he ran real fast to that rabbit. Well, that rabbit was a little bit faster than the dog. And he hid. My dog was so frustrated that he couldn't find that rabbit. And it happened 7 times during our walk. Signs of frustration for us as caregivers, yikes. Here are some signs. shortness of breath. You get a knot in your throat. You get stomach cramps. You might have chest pains. You might have a headache, compulsive eating, excessive alcohol consumption or smoking, lack of patience, or even the desire to strike out. Those are pretty serious symptoms. And as we care for our loved ones, our friends, and our families, some of these signs can appear. Burnout. Ooh, that sounds even worse. Burnout is the physical, emotional, and mental exhaustion caused by long-term involvement with emotionally and demanding situations, and a response to chronic interpersonal stressors on the job. As a caregiver, you might be on the job 24/7. Maybe you're on the job as a caregiver, as your job, only for 8 hours a day. But you can end up with some physical and emotional and mental exhaustion. Signs and symptoms. Signs and symptoms. I love this picture. Signs of burnout. Look at this one right here. Look at that. That match is almost all the way down. That's our goal today, is not to be like that match. But signs of burnout: boredom, lower quality of care, depression, fatigue, frustration, gastrointestinal disturbances. There's that headache again. Insomnia, you can't sleep. Physical and emotional exhaustion, weight loss. In the healthcare field, there's staff turnover, and that can be a sign of burnout. The next definition I want to talk about is kind of something maybe new to you, but it's called compassion fatigue. I love that heart. You can see the compassion in the middle. You can see all these terms that go along with compassion, because typically the person that you're caring for, you have compassion for. You want to help that person. You love that person. You feel for that person. You want to be cheerful for that person. You want to be with that person when that person is ill, or if that person is dying, or that person is hurting. Compassion fatigue. Wow. Compassion fatigue. There's a lot of definitions here. I'd like to go through each one of these. Compassion fatigue is a form of burnout that has progressed to a higher level. It's a result of repeated exposure to the suffering and/or trauma of others. In other words, it could be a heavy heart, a debilitating weariness brought on by repetitive, empathetic responses to pain and suffering from others or those who you are caring for. Day in and day out, caregivers struggle to function in caregiving environments that constantly present heart-wrenching emotional challenges. Compassion fatigue, normal displays of chronic stress. We already know what stress is, resulting from the caregiving work that is chosen to be done on a regular basis. And this is found in the workplace environment, but it also can occur in individuals caring for loved ones at home. Now, some of you caregivers are long-distance caregivers. What I mean by that, here's some examples. When I was working at the Israel Family Hospice House, we would have a patient here from Ames whose closest relative lived in Ames and was a close caregiver for many months. There were other siblings that lived on the East Coast, the West Coast, who were long-distance caregivers. And it was difficult for them. They can have these same feelings of stress, frustration, and burnout, even though they're not near the person that needs the caregiving. So what can you do from far away to help caregive somebody that you love? Well, you can help with finances, which includes money management. You can help pay bills. You can arrange for in-home care. That could be professional caregivers, calling your durable medical equipment place and say, you know, my mom, I think she needs a walker. You can call for home health care. You can call for hospice. You can call the friends down the street and say, hey, you know, can you please check in on mom today? You know, I've been trying to call her. She's not answering her phone. Could you please just go over and just see how she's doing? You could locate an assisted living facility or a nursing home. You could provide emotional support and occasional respite care for the primary caregiver. So if that caregiver is in the home setting, you could maybe take PTO, paid time off from work, and relieve your sibling for a week, just so they can take some time to heal. Because caregiving is a hard job. You could serve as an information coordinator. So if the caregiver has insurance and there's issues with the insurance, you could be that person that could talk to the insurance company. Or you could be the person that talks to the physician. I know with McFarland, we have My Chart, and I'm sure there's many caregivers that don't live in Ames or the surrounding community that can use My Chart and share information about their loved one. You can keep family and friends updated. And you can create a plan and get paperwork in order in case of an emergency. Now here I'm back at the hospice house with this caregiver and their loved one. And the siblings that are far away, a lot of times will come in and they won't have the same ideas as that caregiver who had a lot of contact with the person that they're caring for. They know what that caregiver wants. So communication is so, so important. I remember my mom, she had congestive heart failure. She had chronic obstructive lung disease. She had an enlarged heart. She was obese. She had been in a car accident years before, so it was difficult for her to get around, but she got around pretty good. And I remember having a meeting, because I'm the nurse, of course, with my family. So my father was there, my brother, my sister, their spouses were there, and we were able, well, actually, I was able to share about mom's disease. I said, now you know, mom's not going to get better. She has these diseases that she may feel better, but she's not going to get clear up here where she used to be 3 years ago. She'll go down, maybe be hospitalized, and then she'll start getting better, but she'll never get back up there. We also talked about what Mom wanted to do with her end-of-life cares. Now, she wasn't even at that stage yet, but I wanted the family to know, what did Mom want? So communication is a big thing, even for those caregivers who are long distance, away from the caregiver. You know, we have Zoom. We've been Zooming for the last almost 2 years and FaceTiming. And it's a good idea when there is a single caregiver, but there's others that are long ways away, to have these talks, to have this communication. Because when I talked with my mom, I asked her some really hard questions. I asked her, do you want to go back to the hospital if you need to? Well, if I break a leg, yeah, I do. I said, well, what if your heart stops beating? Do you want to go to intensive care? Oh, no, I don't want to go to intensive care. Well, everybody heard that at the meeting. I said, where would you like to die, Mom? She says, well, I'd like to die right here. We had a hospital bed. She had her TV. She could see my dad in his recliner watching his TV. She had her bedside commode. She was ready to go. Do you want music? She says, well, I love Elvis Presley, so if you have any Elvis Presley music on, you play that for me. The whole family heard this. So when the time came when my mom was critically ill, everybody knew what the plan was. So as a long-distance provider, if you don't know what the plan is, please find out what the person you're caring for wants, whether it's the end of life, whether it's going back to the hospital, whether they want CPR, whether they don't want CPR. There's a lot of medical things that you need to talk about. That's very, very important. Okay, I kind of already talked about signs of compassion fatigue. So I am going to go back. Let's see. Oh, no, I didn't. I'm going to go back here for a second. Recognizing compassion fatigue. There's excess blaming. There's bottled up emotions. There's isolation from others. There's compulsive behavior like overspending or eating or gambling. There's poor self-care. There's chronic physical ailments like upper GI symptoms or colds. There's apathy, being sad or no longer finds activities pleasurable because they're so busy caregiving. It's difficult to concentrate. They're mentally and physically tired. They're preoccupied with the caregiving tasks of making sure that their loved one is being well cared for. They're in denial about this problem. So, you're thinking, okay, the cost of caregiving, wow. There's a lot of cost to caregiving. I remember when my mom was critically ill, and I was working full-time. My dad was home, but he loved to golf, so he was gone for hours at a time. And my dad really wasn't a very good caregiver. Sorry, Dad. But anyway, so I'd get off from work, and I would go buy groceries. I would take laundry home and do laundry. I would help pick up. I would maybe go get something to eat and bring it to them. And at the time, I didn't have my kids. They were all grown, but I did still have a husband. But by the time I got home from work, it was like 7 o'clock at night. and I only had maybe an hour left before I went to bed because I had to get up early in the morning to go to work. The cost of caregiving, yikes. There can be reduced job performance, irritability and blame. I'm sure my husband found me a little irritable at times. Shaken in my belief system, being out of control, placing decisions on hold because you just don't know what to do. You don't know when that person is going to get worse or get better. You don't know if you should go on vacation or stay home. There's decreased levels of self-care, an increased risk of heart disease. We don't want that. There's interpersonal relationships that could suffer. Tasks pile up and chores are delayed. There's deterioration of health, physical and emotional. You can show higher levels of depression, stress, and frustration. And I'm going to include that burnout and compassion fatigue. And that leads to harmful behaviors like we talked about earlier. You can also get a diminished immune system and become infected easily because you're not taking care of your body well. You're not eating well. There's increased mortality. I thought this was very interesting. Elderly spousal caregivers who experience caregiving-related stress have a 63% higher mortality rate than non-caregivers of the same age. Yikes. Baby boomers juggle work, raising children, caring for parents. They have increased risk for depression and possible decline in quality of life. Caring for the caregiver. I just have a couple examples of the many people that I've cared for. First, in a home care setting, we had a gentleman who was dying of cancer. He wasn't in hospice because we didn't have hospice at the time. He was just in home care. And his wife, she was the best caregiver ever. She said, I don't even want you come, but just once a week. You don't even have to come more than that because I can take care of this guy. And she did. She did an excellent job. And I remember when he died, I said, you call me because I want to be there. So she called. And I went to the home. And she says, now you can come to the funeral, can't you? I said, sure, I'd love to come to the funeral. And so went to the funeral. And she was one that had 2 children, one on the East Coast and one on the West Coast. When the funeral time came, she asked me to sit by her. She didn't sit by her children, she sat by me. Caregiving, and the support you receive from those friends who are around you are really good. I tend to love to visit with my neighbors who are elderly. Just recently, I had a neighbor who was 102 years old, and I would go down to her house and just visit with her. I'd take my little dog too, and he enjoyed her visits. But just helping her understand her medications, helping her to understand, what's coming next. And is she prepared for what's coming next? Whether it would be a broken hip, whether it would be end-of-life care. She had no children. Her husband had passed away 10 years before then. She didn't have anybody except neighbors. And it was great being able to be her friend and care for her. My mother-in-law, Neva, loved Neva. Her husband, Leo, had died 12 years prior. She still remained on the farm by herself. She rented out the farm, so she didn't have to do any chores or anything, but it got to the point where she was needing more help. So my husband and I talked, and we kept saying to her, why don't you come up and live with us? You can come up and live with us. We have a bedroom, an extra bedroom. You can stay in this bedroom. And, if you want to help with financially with meals and if you want to give us rent, fine. If you don't, that's okay, because we want to help you out. Well, poor Neva, she was there for the weekend, and we were talking about this, and she got up the next morning and she said, well, will I ever be able to get out of that room? I said, Neva, you can use the home just like it was your home. Yes, you can get out of that room. Well, she lived with us for almost a year, and my husband and I cared for her. I remember every Saturday we would go to a thrift store. I'd get her in the wheelchair, and we'd go around the thrift store just looking at the different items that she might want to buy. Caregiving, we're all going to be caregivers sometime or another, aren't we? But only when we first help ourselves can we effectively help others. That's the key. So you need to ask yourself these questions to remove personal barriers to self-care. Do I think I'm being selfish if I put my needs first? Is it frightening to think of my own needs? Do I have trouble asking for what I need? And do I have to prove that I am worthy of the care recipient's affection? Wow, those are pretty tough questions. Here's some misconceptions that get in the way of good self-care. I am responsible for the health of who I am caring for. It's only me. And if I don't do it, nobody will. And if I do it right, you know what? I'll get love, attention, and the respect I deserve. Another misconception is our family always takes care of their own. And I promised I would always take care of my loved one. Identifying and removing personal barriers to self-care. Remove negative talk. Because as a caregiver, you're going to think, I never do anything right. I can't do nothing that pleases that person. Here's another example. There's no way I could find the time to exercise. There is no way I could find time to go out with my friends. There is no way I could find time, and you fill in the blank. Tools to reduce these caregiving issues is to recognize warning signs early, identify sources of stress, identify what you can and cannot change, and remember, you cannot change another person. When you try to change things over which you have no control, you will only increase your sense of frustration. There's that one of those words again. Stress, frustration, burnout, compassion fatigue. So this is why we're here. We want to know, how are we going to take care of ourselves? Seek solutions for difficult problems. Communicate constructively. Set goals. Ask and accept help. If you're overwhelmed, ask a sibling to come help. If you can't handle it home, what we did, my husband and I with my mother-in-law, it got to the point where two of us could barely transfer her. So we had to put her in a nursing home to get physical therapy. And we told her, if you get stronger and you can transfer, you can come back home. But if you can't, you might have to stay there. You need to start to exercise. How many of you walk? I want to see raised hands. No? Okay. Oh, Vicki, she walks. Good, 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 good. Learn from your emotions. Don't think of those negative feelings or those negative thoughts. Calm down physically. And a good thing to do is talk to your physician about what you're doing and how you're caring for. You know, what you're doing. Boy, caregiving's hard. Now, I know Vicki sent you a copy of this. It says, take the quiz. What fills your cup? Looks like this. There's something on the back, too. You can't pour from an empty cup. So if you're trying to take care of somebody and your cup's empty, it's not going to work well. You're going to have stress. You're going to have frustration. You're going to have burnout, and you're going to have compassion fatigue. So you need to fill your cup. So this is just a little quiz. You don't have to take it now, but what I want you to do is go through each question and mark if you agree or disagree. And then you put your points on the right-hand side. And then on the other page, you can add up your points, and it tells you where you are, where you need to either care for yourself or maybe you're doing a great job. So take time to look at that. Summing up, taking care of you. Now, there's a lot of things. Yeah, we can do it, can't we? Don't you love that, gal? Summing up, taking care of you. Take time to meditate or reflect, at least daily. Journal. Read the Word. Read a book. Take a brisk walk several times a week, at least several times a week. If you can do it every day, that's even better. Lie down or sit in a chair with your feet up. Oh, I love that. Drink plenty of water and eat a well-balanced diet. You got to have those nutrients to keep you going. Because remember, you want to fill that cup. You don't want an empty cup. Try to do something you enjoy every day. Make lists of things that need to be done for you, not for the person you're caring for. What do you need to do? Do you need to get groceries? Do you need to do some laundry? Do you need to go out with a friend? Do you need to send a birthday card? Make those lists. And then, don't you love to check it off? Do one thing at a time. Now, I'm kind of a multitasker, but I see the importance of this. Get one thing accomplished at a time. Set limits on what you can accomplish. Oh, there's a typo. Learn how to say no more often. Yikes. I'm not, that's really hard for me to do because I'm a yes. I'm a yes. Oh, sure, yeah, I'll help you do that. Yes, I can do that even though I'm really tired and I'm not feeling well. Yes, I'll do that. Learn how to say no. I mean, it's okay. Don't try to cope alone. Have a friend, have a spouse, have a pastor, have somebody that you can talk to. Share your feelings with them. Keep a journal of your thoughts and feelings. Maintain your sense of humor. Don't shut out the good moments. Bring up past and present moments that are funny. Give yourself credit for what you do. Caregiving, like I said, is a difficult task, and it's hard to do. But give yourself credit. Say, you know what? That bath I just gave you, wasn't that great? Don't you feel good? How about that dessert that I just fed you? Yeah, I just made that last night because I knew you'd love it. And I think I did a pretty doggone good job making it. Practice a positive attitude. You've got to be positive. You've got to be positive. The last thing I have, and Vicki also sent this to you, is a caregiver's Bill of Rights. It's one page, looks like this. And I think this is more summing up about taking care of you. I'm not going to read this to you. You have it yourself. But at the bottom, you might want to add something else. Add your own statement of rights to this list. And read this list to yourself every day as you care for your loved one. So, that's the end of my presentation. And if we have any questions, please, I think Vicki had the instructions there on how to do that. And we're here to...
In that upper right-hand corner, open up the arrow.
Yeah, she did that. He did that.
Oh, there you go.
Aha. Questions.
Let's see. Well, it doesn't look like we have any questions yet, so that's okay. Great job, Val. Maybe a few will come in as I'm closing us up here, and if they do, we'll have you hop back in.
Because I have
and
one
answer.
more thing to say.
Oh, then go for that.
How did I do? I told Vicki, I said, you know, when I had people here, I could give out evaluations. But, yeah, I just want to know. So if you want to put how I did in the question answer thing, I'd kind of like to know, even if I didn't do very well.
And if she didn't do well, what could she have done? How about that?
Yeah, that's good. That's good.
Yeah, and just so you know, other people will not see this. This is just comes through, and we have it in a view that only we can see the comments being made. So, and it looks like it's saying great, 2 thumbs up. So, and it looks like they're all nice comments coming through. But
thank you.
I'll keep watching. And
That
you did do a wonderful job. So thank you, Val. But don't run off because maybe there will be a question that comes through.
Okay.
Again, thank you everyone for joining us today. It was a great information and something a lot of us need to hear and we need to take to heart. And you need to share this information with other people as well. We have a couple upcoming programs in August. You should have all received your flyer a few weeks ago. Wednesday, August 11th, we have Dr. Lake, who is with McFarland Clinic Radiology, doing a program on what's an esophagus attack. And then the very next day, Thursday, August 12th, we have Megan Benzing with the Alzheimer's Association and Denise Kluver, who is a community volunteer for the Alzheimer's Association, giving a program on understanding Alzheimer's and dementia. And that's actually the first in a series of 3 programs related to Alzheimer's, memory loss, and such. The other ones are coming up in September and October. So again, you can go to that mgmc.org/PTA to sign up for one of those programs. So we do have a question. I would be interested in knowing your thoughts on how to take care of yourself when you are mentoring others who have deep needs and tend to be very needy.
Wow. I would set boundaries with that person who's very needy. I don't know how needy this person is, if it's medical needs or if it's other types of needs, but I would make sure that you have boundaries set for yourself and that other person knows it. I don't know if that is where you're coming from.
It's kind of hard when we don't know specifically, but it sounds like mentoring somebody and must be maybe relying on their mentee for a lot of help and support.
Right.
And so,
And I guess another thing, if it gets too much for you, I would recommend professional counseling. Because sometimes we don't know how to handle things like that.
right?
My husband is a professional counselor, and he has met with many people, and I think that's probably the best thing to do. It says, okay, mentor for young college students. Boundaries are great. Yes. Yeah, college students. Ooh, boy. They sometimes have a mind of their own.
You know, and it sounds like you're kind of into it, but sometimes I think what my advice would be with situations like this is from the get-go, from the start, to set up those boundaries.
Exactly.
Because it's sometimes hard once you're into it, how far, and you didn't realize. So taking that time ahead of time to think about, now that's not going to help you now, but maybe down the road.
And that could be like, times to meet.
Right.
Times that you're available. It'll mean phone calls not after 10 o'clock at night. It could mean, I'm not going to give you any money. I mean, there are things that you need to let them know so they aren't trying to either manipulate you or, yeah.
Okay. Wonderful. Well, thank you. Again, I think somebody is asking, her name is Valerie Bohlen, was asking that. I think that's the last of our questions. So once again, thank you, everyone. Hope you can join us for one of our other upcoming programs, and have a great day.
Thank you.